Welcome, I'm Dr. Rich Miller of Central Oklahoma Oral and Maxillofacial Surgery Associates, or CUMSA for short, and I'm very lucky every day to be able to pursue my passion of transforming people's lives by bringing them back their smile. So CUMSA is the home of the All-On-4 or Teeth in a Day procedure. We're actually a national recognized center of excellence for the All-On-4 in the United States. We're at our Stillwater office today. We have 3 offices, one in Tulsa, one in Stillwater, and one in Oklahoma City to make that more convenient for you. But we're going to take you into the office now and show you how this procedure works. But first, if you're somebody who's been suffering from dental pain, from cavities, from loose teeth, missing teeth, crumbling teeth, or maybe you don't even have teeth. Maybe you've been suffering with a denture and the movement and the sores in your mouth and the goop that you have to use to try to keep that in place. There's no reason to do that anymore. We can provide you a brand new smile, believe it or not, in one day. So let me show you how this process takes place. Come on in and follow me. No matter what your dental issues have been, the minute you walk in the office, you're going to find people who are excited to help you through this entire process. So let's meet a couple of our key players here. This is Tracy. Tracy's been with us since 1996. She knows pretty much everything about everything. And this is Ashley, who's our amazing office manager, helps everything run smooth so we can make this process as easy as possible for you.
When I first came to CUMSA, I was a little apprehensive, and then when I got through the door, everybody was so warm and wanted to make sure that my outcome was what I chose.
I know there's a lot of you out there that kind of just given up on dentistry. Maybe you went in and initially you had a toothache, and so your dentist says, well, hey, there's a cavity here, let's get a filling. And then later on, the tooth starts to hurt again. Well, it's now abscess, so the dentist says, let's do a root canal. You need a crown on that. And later on, the next problem is the tooth is now cracked, you have to take it out. You spent all that time, all that money, and it's very frustrating. Most everyone that comes to us has been suffering dental issues for a long time, maybe even years. It affects their physical health, it affects their emotional health, especially it affects their ability to smile. I have so many people that come in and say, I don't even want to get out of the house anymore because my teeth are so bad, I don't want people to see me smile. So just know that there is hope out there. How nice would it be to go to a restaurant and pick up the menu and not have to worry about what can I eat on this? How about thinking, hey, I can eat anything on this menu. How about that big juicy steak? Or how about that corn on the cob? Or how about that delicious salad that you can't have right now? Come see us. We can restore your smile. We can restore your ability to chew foods, to enjoy life. We can restore your confidence.
Before I came to CUMSA, it was hard to eat even an apple, anything hard. My teeth always hurt, had pain all the time. And now I can eat anything I want.
Back when I had dentures, I didn't enjoy eating. When I would eat, they'd slide, or I had to get up and go put stuff in them. If I was in a restaurant, I carried a tube in my purse because of that. So third time they slid, I'd quit eating. I wouldn't eat no more.
The other dentist that I had been to I would know I would have an infection. We would fill a cavity, and then 3 months later, another cavity, the filling would fall out, and I'd get that one. 3 months later, the one they put in prior. It was a never-ending 3 to 6 months to the dentist for fix and repair without help. And I spent an awful lot of money getting nowhere.
Well, my teeth had deteriorated to a point that I was breaking off in half probably about every other month. A lot of it was age. Some of it was, some hygiene problems when I was younger. And so they were at a point where they were causing an infection in my jaw, in the bone structure. And so the dentist that I saw in Cushing, Oklahoma, where I'm living, said, we're gonna have to do something drastic because you're not gonna be able to keep your teeth if it keeps deteriorating at at the rate it was. And so that led me over to Kuma.
I still had a full mouthful of teeth, and I was doing okay, but I was in a whole lot of pain. We seen this on TV that said, teeth in a day. And Rick looked at me and he said, honey, I think that's what you need right there. And I said, you know what? That sounds good.
You know, anytime that you've got a change in your appearance, in the way you function, it has a downside in how you operate, how you feel like you present yourself. And losing your teeth, and you stop smiling. You find that you're not able to eat the stuff that you enjoy, things that are crunchy. I'm a big steak eater, and so it made an impact on my diet. So there's nothing pleasant about teeth problems.
Physical issues with my teeth prior to this was reluctance to laugh and engage with the children and people at my job because of my appearance, and my esteem was low because of that, but things are better, much better now.
We can offer you a fixed set of teeth that are customized just for you, that don't go in and out of your mouth. Let me show you how we do this. There are 3 key phases in our process for getting you the perfect smile: consultation, smile design, and implant placement. This is where the journey begins, with a complimentary specialized consultation where we'll take a CAT scan, and that gives me a chance to assess your bone structure and determine if you're a candidate for this procedure. Every patient's unique. We all have different genetics, different dental histories, different medical histories. When you come to see us, we're going to treat you as a person, not a number. And that brings us to Julie, our implant coordinator, who will walk with you from start to finish through this entire process.
Hi, my name is Julie, and I'm the implant coordinator for Dr. Miller. I'm here to sit with you and talk to you about the process, explain things of what to expect. Patients often ask things like, how much pain am I going to have? How long does the process take? What is the cost? And what does my insurance cover? All things that I will go over with you in detail. For patients needing financing, we have several options that we can look into to find you a monthly payment that fits into your budget comfortably. We have patients from all walks of life that come in that have multiple different dental issues, and we want you to know that when you come here, you will feel comfortable. There is no judgment. We just want to make sure that we are answering all the questions that you need answered to make this the best decision for you and your situation.
People were amazing. They weren't judgmental at all. They didn't look down on me because I was real subconscious of the way I looked, and nobody made me feel that way. They just made me feel good.
My name is Dr. Michael Lloyd, and I did my training in Chicago, and that's where I first learned the All-On-4 procedure. And I was able to realize how it would transform and restore their smile in their lives. I decided to join Dr. Miller and his team here at Kuma because I was able to see how they had a lot of compassion and care for their patients, and I saw it as a core value. Working with Dr. Miller here at Kuma has been very inspiring. Seeing him put in so much time and technology, he invests so much of his own personal time and money and effort in trying to enhance the lives of the patient.
Boy, Dr. Miller is a great guy. He is authentic. He's just very kind. I think that his purpose is to do the best job with everybody that he works on. And I felt really good that he worked hard to get me a set of teeth that fit and look good. And so I'm thrilled. It's certainly worth the money to me and the time.
There was a lot of options that can be had, and the process was easy. I didn't have any difficulties whatsoever taking care of this for myself because it was necessary.
Affording this was, the way I looked at it is, I had gone to the dentist, it was root canal after root canal. My dentist set me down and said, "You've got so much more work to do. And by the time you do that, you might as well just get this."
So this moves us from our consultation to our smile design. So you've been to the dentist's office most likely and had a traditional impression taken where they have a big metal tray and they put a bunch of goop in there and they put it in your mouth and you're about to gag. That would be me. And you can't wait to get it out of there. Well, now we're able to do this all digitally. So there's just a small wand that passes over the surfaces of the teeth and gum to give us a three-dimensional image that we can take to our laboratory software and create a beautiful new smile just for you. We've got a CAT scan, we've got a 3D intraoral images, we've got a 3D facial image, and now we're going to bring that back to the lab, and this is where the magic happens. We're going to take all that information, we're going to plug it into our dental software, our designing software, and then we'll be able to make a new smile, custom designed just for you. We've made a tremendous investment on finding and implementing the latest in dental digital technology throughout the office. That makes the process easier for you and allows us to give you the best result possible. From the consultation to the design, to the placement, to the follow-up, technology is utilized in every part of the process. Every step is designed to enhance the process so we can get you back to leading your best life as quickly as possible.
I really appreciate the fact that they allowed me to customize my own teeth to my personality and my lifestyle.
Being able to pick the color of my teeth was really important to me. That process was really pretty easy because they have a whole selection of color samples so you can match what you have, what you'd like to have. They made it real easy. The technology's unbelievable.
When I came in, they customized my teeth. The first set they put in, I came back in like a month later. I didn't like them. I could change anything. I could change the shape of them, the whiteness, and all the shades I wanted, and I got to completely pick everything. Getting teeth customized to my mouth was important because I actually got the teeth I always wanted, or even better than the teeth that I had before.
Once your smile has been designed, it's time for the placement phase. You will come into our office for an outpatient procedure to get your old teeth removed and your new smile installed on the same day. So now that we've got our new smile designed, we're ready to put the implants in. So day of surgery, you're going to come to one of these surgical suites. We'll get all our monitors on, you go to sleep, and that's really all you should know about. So while you're asleep, if we have teeth removed, we'll do that. If we put in the implants, we'll put in some dissolving stitches. When you wake up, everything's numb. Hard part's done. While the lab's finishing making the teeth that day, we'll get you fed, we'll get your medicines going, we'll throw some Netflix or YouTube TV, and just to keep you entertained. And then we print out the teeth that day on a 3D printer. So everything is pretty quickly. We can custom stain those, and then the teeth go in. It's very emotional. Many times the patients tear up when they get to see their new smile for the first time. I tear up. A lot of hugs go around. The All-On-4 procedure, being able to give people back a beautiful new smile, is what I'm passionate about. It's what I love to do. And I never get tired of it.
When they described the process to me, I was a little bit doubtful, but when I came in that day with all the reassurance and had the surgery process done, was just the best feeling ever. And I couldn't have wanted anything better for myself, and I have been telling anybody who will listen that this is the way to go.
Being able to get teeth the same day was awesome because literally could walk out here and I had a huge smile on my face, which I hadn't had in years. So that was amazing, and I mean, I knew it was kind of a dream come true for me. Totally awesome. The recovery time, getting fillings done was hurt worse than getting this done. I literally was home that day. I just took Tylenol, and I felt great. Later that day, I was absolutely fine. I could speak, I had perfect teeth. It was amazing. Wasn't bad at all.
Recovery time was easy and relatively quick. I was able to go back to work right after. Nobody knew what had happened. I just went back to work and they were just, well, you're really happy today.
The next morning, the very next morning, I sat right straight up in bed and I said, wow, I don't have no pain. I am healed. I have no pain. To know that as old as I am, that there is still hope, that I can be pain relieved and have a smile that everybody turns and looks at. And, well, what are you so happy about?
Now that you have your new smile, over the next few weeks you'll have a chance to test drive it. And as we advance your diet, we'll see how well you function with chewing. And then once you're sure you love your teeth, it's time to mill your final set. We mill that out of zirconia, beautiful material, very tough, doesn't break, doesn't stain. It will give you a very long-lasting, beautiful smile. So this is another part of our digital technology. These are mills. This is a heavy mill, so it will mill anything from titanium on down. This one will mill anything but titanium. So we have two different mills that we can have going on, and this is where we make your final teeth, right here. A lot of dentist offices are able to mill a crown and maybe mill 3 teeth in a row. These allow us to mill out an entire bridge all at one time. Many times, if you're having this procedure done elsewhere, you may go to your dentist initially, and then from there you'll go to your surgeon, and then you go back to the dentist, and they'll have to interact with the lab, so they have to mail off to the lab, they have to receive that back. You may even go to a different office for the CAT scan. We've made tremendous investments in this dental technology equipment so we can make this process easier for you. Having everything under one roof means less time out of your life and more time for you to enjoy the things that you love.
The experience of coming in and having all the technology here in one building without having to go place to place was the best thing I'd ever had experienced in any medical profession anywhere.
Having been through the process now, it is worth the investment. The time they take, the technology, the concern, the care, the customer service is impeccable. I'm happy to have teeth where I can smile and not teeth that are breaking off at night.
Here at KUMSA, we're all about changing people's lives for the better. So let's take a look at a few of our patients that have completed the transformation process. The first patient we're going to look at today is Braun. Braun came in with complaints of tooth pain for the last 10 years or more. He said his teeth were crumbling, he didn't like to smile anymore, and just generally wasn't happy. And here we are with Braun's pre-op picture. So he had several missing teeth. A lot of the teeth that he had were badly decayed. He's had several root canals, he's had several crowns. Things were just starting to deteriorate. So he's actually had veneers across the front of his teeth, but the teeth themselves were badly decayed, and it wasn't something that was going to last long term for him. After the procedure, he has a beautiful smile. You can't keep him from smiling now. He likes to get out, spend time with people, which he wasn't doing before. He feels like he's just ready to take on the world. This is John. When John first came to us, his chief complaint was that he couldn't eat anything specifically that was cold because it hurt too much. And during our initial exam, we noted that John had multiple decayed teeth. The cavities were very deep, and that was causing him a lot of pain when he tried to eat cold food. After his transformation, John says he can eat anything he wants to now, including cold foods, because it's no longer painful. Our next patient is Pat. When Pat came to us, she had an upper denture, and we can see in the picture that her teeth are short. She shows a lot of gum. She wasn't happy with her smile. She was not happy with her ability to chew. Her goals were to be able to smile again, to have natural looking teeth, and to eat anything she wants, like biting into a hot dog. And the nice thing about being able to do this in-house is that we're able to customize the staining for the gums. Not everyone has bright pink gums. Sometimes people have darker gums or pigmented areas in their gums, and we're able to draw that into the bridge so that it'll make it look a lot more natural. So now Pat loves her smile. She can eat anything she wants to eat, and if I see her at a Thunder game, I'm gonna buy her that hot dog. Let's meet Linda. Linda was referred to us from her general dentist. We see a lot of patients that are referred from their dentist, but we also see a lot of patients that are self-referred. Okay, as you can see by looking at Linda's before picture, she has some staining, she has some crooked teeth, she also has some missing teeth. We were able to give Linda a brand new set of teeth made from zirconia, a very durable substance that doesn't stain. So now she doesn't have to worry about crooked teeth or staining anymore. When Linda came in to see us initially, she did not like her smile, and now she loves it. This is John. John came to me with a chief complaint of it hurt to eat. Even chewing was painful for him. He had low self-esteem because he didn't like his smile. In our initial consultation, we learned that John had multiple cavities, he had multiple missing teeth, and it just hurt to chew. When you have to chew on teeth that have cavities and you're chewing on the gum, it's just very uncomfortable. After John's All-On-4 transformation, he tells me now he doesn't have to worry about anything. He can eat anything he wants, hot or cold. It's not uncomfortable for him. He tells me this has been a very liberating experience for him. And he tells his wife every day how much this has changed his life. This is Brian. Brian came to us with complaints of inability to eat well. If you look at his before and after picture initially, it's not all that remarkable, but if we look at his intraoral pictures, this is what we found. Brian was only biting on his back molars, his second molars, nothing else touched. And so he did have a hard time chewing foods. If you can imagine trying to eat a hamburger or a sandwich, letting go, you have a lot of things that stay behind. So now that Brian has his new teeth, and now that all the teeth line up, he's able to chew properly without difficulty. He's able to enjoy all the foods that he loves.
When I hear the word Kuma, when I hear Dr. Miller's name, I know that I will be taken care of. I know I will find people that are caring, people that are kind, people that are knowledgeable, people that are really interested in helping you to smile.
They've made my life so much better. Just the care for you, a complete stranger, was amazing. Family, they're my family.
And I've never had better customer care than we received here at Kuma. Unbelievable. My wife was sitting there next to me and she says, I cannot believe it. And she's been in hospitals multiple times. That service, that care, that concern, from when you come in to when you leave, that is so critical to the staff here, is just unbelievable. The best I've ever had, and I've been through a bunch.
The customized teeth fit like a glove, and I don't have all the things that go with dentures of things getting under and over. You don't have to worry and hurry up and go rinse things off and put them back in. They're there every day. And easy to take care of with your natural teeth. Just brush them, water pick, and go. And they fit like a glove.
My son is an RN, and he researches all the doctors that I have to go to or a procedure I'm having done. He came when I had the procedure done here, met everybody, and when the procedure was over with and Dr. Miller walked us to the car, he told him he had a fabulous group working here and he would send anybody here.
My health was so much better. I just felt like that no matter what, we could afford this. And this is where I'm at today with good health. And I'm so thankful that they were here for me. It was God's will that we could do this, and it was great.
With my new teeth, one of the things I'm getting back to eating everything that I want to eat. There hadn't been any drawbacks. There's nothing I can't gnaw down on if I want to, from corn on the cob to sunflower seeds. And so it's changed the way that my life works, and I appreciate that.
First thing I did with my new teeth was show my family the process I'd been through, and my grandkids wanted to know if I could eat pizza with them, and I did, first time in years.
Well, I had teeth crowned, and I'd have to go to the dentist all the time for work. And now that solved all the problems. I haven't had any trouble with my teeth at all. And they fit well. I can eat anything that I want to eat. And I get lots of compliments from my family and friends that, hey, you look younger and you look more vibrant and you smile more. So I'm really happy. I don't know why I waited so long.
To walk in the first time, seeing your teeth that are missing and knowing that you have more that are going to be fragmented, falling out, falling apart, discolored, and come back several months later with a brand new set of teeth that don't come out, that are there for life, that are white and shiny, and you look in the mirror and you see the grin that you always wanted to have. That speaks volumes.
So no matter how discouraged you are, if your dentist has said, hey, you don't even have enough bone for dental implants, come see us. We've been doing this since 2005. Let me show you how we can make this work for you.